This show is for educational and informational purposes only. This show is not meant to evaluate, diagnose, treat, or prevent any foot problems. Shoes are very important to a person with diabetes. Poorly fitted shoes are involved in as many as half of the problems that lead to amputations. As a person with diabetes, you should begin to wear shoes and socks that pose no threat to your feet. You should have at least 2 pairs of shoes and should change them in the middle of the day or at least daily. Even a small area of high pressure can cause a problem if you wear the same shoe all day, every day. With more than 1 pair of shoes, pressures vary and ulcers are less likely. Remember, shoes are of supreme importance for people with diabetes. The longest nerves in the body are to the feet. These nerves are the most often affected by neuropathy. If you have peripheral neuropathy, you can no longer trust the feel of a shoe to determine proper fit. To obtain the same feel on your feet, you may incorrectly prefer a smaller size shoe because of lost sensation. Once protective sensation is lost, you are 15 times more likely to develop a foot ulceration. Proper footwear. The American Diabetes Association states that the objectives of prescription footwear include relieving areas of excess pressure to the bottom of the foot, reducing shock, reducing shear stress, accommodating deformities, stabilizing and supporting deformities, and limiting motion of joints. Diabetic shoes are proper footwear. Diabetic shoes are also known as therapeutic shoes. Diabetic shoes and pressure-reducing inserts protect feet only if you wear them every time you are on your feet. A pedorthist is a person trained to manage and treat conditions of the foot, ankle, and lower extremity, requiring the making, fitting, and adjusting of therapeutic shoes, diabetic shoes, braces, and orthotics. Proper shoe fit. Always inform your shoe fitter that you are a person with diabetes. You should be properly measured and fitted every time you buy new shoes. Be aware that your foot size and shape may change over the years even as you age to be a senior. Because feet swell during a day's activities, your shoes should be purchased in the afternoon or evening when the foot is usually at its largest. There are many ways to measure feet. Here are some guidelines for proper shoe fit. Measure both feet each time you get new shoes. Fit both shoes while standing. The widest part of the foot should be in the widest part of the shoe. Shoes should be fit for arch length rather than overall length. 1/2 inch should be between the longest toe and the end of the shoe. A small amount of leather should be able to be pinched up at the vamp area of the shoe. Make sure you can wiggle all your toes. You should have a snug fit around the heel. Also, a good fit is needed over the instep. The shoe should bend where the foot bends. The tread of the shoe should make you feel secure and balanced and stable. You should be able to walk comfortably. There should be no break-in time for the shoe. It should fit comfortably at the time of fitting. Heel slippage at times occurs in new shoes until the sole begins to bend and the heel of the shoe begins to ride with the foot. Heel grips may help reduce heel slippage. A tongue pad may push the foot back into the heel of the shoe. Lacing techniques may be used to help with heel slippage. Inserts may help with fit. Heel cups may be necessary. And remember, a little heel slippage is needed. There are 3 commonly used measurements in determining a shoe selection. overall foot length, arch length, and width. Foot measurements are only part of the shoe selection process. In this slide, we're going to talk about the Brannick device and how it measures the foot. If you look at figure A, there are 2 feet, the same length. Foot 1, the toes are short, but in foot 2, the toes are long. Notice that the arch lengths are different for both feet. Foot 1 has a longer arch than foot 2. In figure B, a long arched foot is crowding the toes in the shoe. In figure C, the shoe is properly fitted. The Brannick device incorporates not only length, but arch length to determine a proper fit. Shoes are made to bend at the ball of the foot. Correct fitting places the widest part of the foot, which is the ball of the foot, in the widest part of the shoe while providing room for the toes. Lacing techniques can help improve fit. If you have a bump on the top of your foot, a skip lacing technique may be employed. Stop lacing accommodates a wide forefoot and a narrow arch, or vice versa. Your old shoes. What do you wear? Wear only the shoes that have been discussed, seen, and approved by your doctor, podiatrist, or your pedorthicist. Inspect the inside of your shoes daily for foreign objects, nail points, torn linings, and rough areas. Bring in any shoe you wish to wear and have it approved. Give away or discard shoes that don't fit or are not approved. New shoes. Checkout period. Although shoes should fit comfortably at the time of fitting, a checkout period will give you a chance to prevent problems by early detection. Your checkout period is different than breaking in new shoes because diabetic shoes should be comfortable at the time of fitting. Guidelines for checkout. New shoes should be checked out slowly. Wear new shoes 1 hour in the morning and 1 hour in the afternoon for 3 days, checking for red spots, hot spots, blisters, or sores. If any signs are noticed, the shoes should not be worn. Contact your physician or pedorthicist and make them aware of the findings. If no signs are noticed, then slowly increase the time you wear your shoes. Check your feet often during the first few weeks. You should check your feet 3 to 5 times a day. Have a family member help check your feet or use a mirror to see the bottom of your feet. Once checked out and rechecked by your pedorthicist, podiatrist, or doctor, your shoes and or orthoses should be worn whenever you walk. Check feet every day once shoes are checked out. Check shoes weekly for signs of wear and tear, and have them repaired or replaced accordingly. Check for broken laces or eyelets, torn or thinning linings, excessive outsole wear, or sole or midsole compression. Always wear socks with your shoes and orthoses. Shoes. Good choices are athletic shoes, low heels, Oxfords, Mary Janes. Poor choices are high heels, flip-flops, backless shoes, or cowboy boots. There are 3 types of shoes: street shoes, diabetic shoes, and healing shoes. Street shoes are shoes you choose. They're usually a good athletic shoe. They are not worn with loss of protective sensation. Diabetic shoes are chosen by your medical team. They prevent ulcers but do not heal ulcers. And healing shoes. They are chosen by your medical team and they heal ulcers. Diabetic shoes are as important to your feet as your medications are to you. Some of the characteristics of diabetic shoes include plenty of room in the toe area, a shoe with lace closures or Velcro straps, a strong heel counter, a padded collar and tongue, minimal seams in the upper, shock absorbing sole, low heel, soft breathable upper. Diabetic shoes are insulin for the feet. Don't buy diabetic shoes over the internet. You need to be properly fitted and measured each time you buy your shoes. Medicare footwear benefit for people with diabetes. Any one of the following qualify you for diabetic shoes. If you have a history of a partial or a complete amputation of the foot, if you have a history of a previous foot ulceration, if you have a history of a pre-ulcerative callus, if you have peripheral neuropathy with evidence of callus formation, if you have a foot deformity, or if you have poor circulation. Wear shoes and socks at all times. Do not walk barefoot when indoors or outside. It is easier to step on something and hurt your feet. You may not feel any pain and not know that you hurt yourself. Make sure you wear socks, stockings, or nylons with your shoes to keep from getting blisters and sores. Choose clean, lightly padded socks that fit well. Socks that have no seams are best. Check inside your shoes before you put them on. Make sure the lining is smooth and that there are no objects in your shoes. Wear shoes that fit well and protect your feet. There are only 3 times you can be without shoes as a person with diabetes: in bed, in the bath, and at the medical team's office. In fact, at the doctor's office, you should take your shoes off so he can see your feet. The doctor needs to be able to see your feet to evaluate them. Please note, carpeting does not prevent you from stepping on pins or needles, tacks or toys, or any of the various things on the floor. Most car accidents happen within 5 miles of home. Likewise, there are many hidden dangers for your feet in your home. So wear your diabetic shoes at home. Dr. Joshua K., podiatrist, says, whatever the problem is, don't bury it in the shoe and hope it will go away. We call this shoeicide. 10 things to remember about shoes. There is no standardization to shoe sizes. Each manufacturer has a different sizing system, and within the same brand they can be different sizes for each shoe. If the shoe fits, wear it. Size your feet every time you buy your shoes. Your feet changes sizes as you age and usually gets larger. Shoe shape should follow the foot shape. About a ½ inch should be between the longest toe and the end of the shoe while standing. The widest part of the foot should be in the widest part of the shoe. Fit in the afternoon. Your feet often swell during the day. Shoes should be comfortable at the time of fitting, both standing and walking. Fit your shoes to the larger foot. Break in shoes slowly, and inspect your shoes before wearing them. As always, we are friends in the fight for feet. This is the Diabetic Foot with Dr. Jones.